Hello, my name is Louisa O'Mara. I'm a research coordinator senior at Northern Arizona University, the Center for Community Health and Engaged Research, and I'm here to show you today a useful tool that we have developed we're calling the Arizona CHW Physician Expense and Reimbursement Estimator. Before we jump into it all, I want to be sure to acknowledge, as you see at the bottom of the screen here, that this tool was adapted from something of the same name, essentially, developed by the Community Health Worker Collaborative of South Dakota. So we're very grateful to Ben and Vicki at the CHW Collaborative of South Dakota for sharing their template and their very valuable experience with the CHWs of Arizona and allies. Um, all right, so the purpose of this tool is to assist Arizona CHW programs to estimate the costs associated with employing a CHW, taking into account Medicaid or access reimbursement for approved services. So I'm going to walk you through how this works, sort of tab by tab. And so where we are is in the first tab. So if you look at the bottom here, they're color coded. So, and they're also numbered. So number one, start here, is where we are looking at the moment. And so this is, before you get into it, we want to always start here to make sure you're in the right tab, so we understand the purpose of it and how it works. So the way it works is it uses Excel. It's to for a CHW program to enter the total cost of employing a CHW, and how many hours they work, and estimates of how many Medicaid reimbursable hours they might work in a day or a week. And then there are built-in formulas that auto-calculate estimates for total return from Medicaid reimbursement, both weekly and annually, in comparison with total CHW position costs. So in our quick guide to tabs below here, we see that there are different Medicaid codes that are possible for billing for CHW services, and they can be found. I'm going to jump to a green tab real quick so you understand what I mean when I'm talking about the codes. So our number 6 is our if we go to this last green tab, we see from Access, from Arizona Medicaid, they've shared the 3 approved billable codes for CHW services. So these are 98960, which is for education and patient self-management, a visit with an individual patient. And these are in 30-minute increments. And we have the fee-for-service rates here. The second code is 98961. This is for working with 2 to 4 patients. Again, a 30-minute increment, and the rate for that's per patient per 30 minutes. And then the third code, 98962, is for working with 5 to 8 patients, again, 30-minute increment, and our fee-for-service amount per patient. This, the amount you see here is for fiscal year 2025, effective October 1st, 2024. Below here, you see a bit of details about billing caps. So there are maximum of 4 units per member per day, and 24 units per member per month are may be billed. And then a note about the calculations in the workbook, because in the workbook, what you're going to see is estimates around visits with a single patient, the 98960 code. And then for the 2 group codes, we had to choose a number. So in the 2 to 4 group, we chose 3 for our estimates. So that's what you'll see for that, for the second code, 98961. And then for the code for visiting with 5 to 8 patients, again, we chose one in the middle and went with 7. And that's our estimate is based on working with 7 patients. So back to our start here. In our first tab, start here. So this, so if your CHWs for your organization provide services to both individual and groups of Medicaid clients, so for instance, possibly diabetes education or some kind of maybe something around hypertension with a group that would all be billable, then we recommend using the blue tabs, so tabs 2 and 3, because those tabs allow for estimates using all three billing codes for individual and for groups. But if your CHWs only provide services to individual Medicaid clients and would not do the group work, then you can use the pink tabs 4 and 5 for your estimates because they only take into account billing for individual client services. So then this below we see a little more clarification about what I just said, that tab 2 and 3 are around all three codes. Tabs 4 and 5 are just around the single patient codes, and tab 6 is the rates for each of the codes for FY 2025. So for the demonstration today, I'm going to show you, we're going to work in the blue tabs, which are looking at all three codes. So if we go to tab 2, we can see at the bottom it says individual and group patients. We have the instructions at the top. The most important thing to note here is that you enter information about the CHW position into the light green boxes only. The rest of the spreadsheet, all the other boxes, have formulas in them that auto-calculate totals based on what you enter in the green boxes. So there's no need to, even though it looks like there's a lot on here, there's no need to actually enter anything in any of the gray boxes or the pink boxes, only green. All right, so to get started, we have CHW salary and hours. So the first green box here, you want to put in their hourly, the CHW's hourly rate, and that needs to take into account not just the hourly rate, but also the benefits worked into it. So in the example that we have here, if the hourly rate is $19 per hour and the benefits are estimated at 30%, you'd put in $24.70 as the total CHW hourly rate. I'm going to go ahead and put $25 in here just to keep the math really simple. So there's my hourly rate. And then in hours worked and reimbursed, we're thinking about Medicaid reimbursable hours, okay? So a really important thing to note here. The first box says Medicaid reimbursable hours per day with one patient, single patients. So in this top box, what we want to put in is an estimate of how many hours on average per day would your CHW potentially be providing Medicaid billable services. So let's just say it's 3. And then we have our group codes. So now these two, we're assuming that CHWs are likely to see single patients, individual patients on a daily basis, but that this group work, working with 3 patients in the 98961 code and working with 7 patients in 98962 would happen less often, maybe just once or twice a week. So in the 3-patient group, we're just going to put maybe it happens 2 hours a week. And then in the 7-patient group, that's much more rare. Let's say it only happens really 1 hour a week. And the last box here is how many hours a week in total does the CHW work? We're going to, in our example, assume they work 40 hours a week. And now all of a sudden we have the information that is auto-calculated. So I'll tell you how to read through it. So in our first line here, where you put in how many hours per day the CHW is seeing individual patients, and these are Medicaid reimbursable hours, we've got a weekly reimbursed amount for individual visits of $763.80. And then for this small group work in the 98961, where we had 2 hours a week of a 3-patient visits, the return is $147.60. For the large patient group, 98962, so our 7 patients, we did estimating once a week. That would bring in $128.10 per week. So we have a total CHW cost first of $1,000 a week, because we've got $25 an hour times 40 hours a week is $1,000. And then our total weekly reimbursement, if we add up our numbers up here from the visits, we end up with $1,039.50 per week in reimbursement. So our difference is actually a positive number. We've got 39.50 because the CHW cost was 1,000, but reimbursement was 39.50 over that 1,000. Um, so we'll see how it plays out down here. In this middle area, this is looking at, if you had 3 hours per day with a patient of Medicaid reimbursable hours, then of course there would be 5 other hours where that would not be, be doing other things, transportation, seeing patients that are not Medicaid clients, seeing patients who are Medicaid clients, but not providing a Medicaid billable service. That's there's many hours, still many hours of the day that are not billable. Then how that looks by week, potentially 18 hours a week of doing these billable services, 22 hours a week of not Medicaid billable hours. One more box to fill in just to get our final number. This is how many weeks in a year, or working weeks in a year, there are. So this explanation we went ahead and borrowed from the South Dakota template. So explaining that although there are 52 weeks in a year, the average CHW is not actually providing all of these services through in 52 all for all 52 weeks. They suggest that with a couple of weeks of vacation and a couple of weeks of federal holidays, maybe there would only be 47 or 48 working weeks. So we'll just say 48. And now we have all the boxes are filled in. So we're looking at annual, so a yearly reimbursement and total physician expenses. So our annual reimbursed amount, based on those working weeks we put in our 48 weeks, is $49,896 could be reimbursed over the course of the year. And our total CHW cost is $52,000 a year. So here's our remaining difference. We've got $2,104 that would not be able to be covered by reimbursement. There's a spot down here to be able to put other expenses. So there might be other expenses besides benefits and that salary that go into the CHW physician cost. So something like mileage, reimbursement, cell phone, other types of expenses you want to calculate into your total. So you might put something like mileage and know that that costs the program perhaps $300 a year. So this is an annual amount. So that gets added to our total remaining difference here. Okay, so now I'm going to show you the pie chart of what this looks like for annual expense versus annual reimbursement. So here on tab 3, the pie chart for individual and group codes, we can see the that if your CHW is actually able to do 3 hours per day of Medicaid reimbursable work and the 2 hours of the small group and 1 hour of the large group, that 95% of their physician costs could be covered by Medicaid reimbursement, with only 5% of remaining for the that the program would need to cover. I'm going to show you, explain about this note here about the positive number, possibility. So let me just show you, if we see just a couple more patients, let's say we do 4 hours a week of Medicaid reimbursable work with individual patients, then we see our number here of the remaining difference is a positive number, which means in our pie chart gets a little funny, because what happened is that in our estimate, 100% of the physician cost was covered through reimbursement. And this, why it says negative 14, is that this is the overage beyond 100% of what would be recouped through reimbursement. So this is a note that explains what happens if this is a positive number. Now, we realize that that isn't necessarily going to happen. You may never see those small groups, and you may only really do 2 hours a day with with individuals. And so your pie chart might look more like something like this, which is nearly 60% of the physician costs being covered by reimbursement. and the remaining 42% would be covered by the program. And that was with just, sorry if I moved too fast, that was just with 2 hours per day with individual patients and one large group session per week. That's what our estimate looked like. And then the last thing to note on this tab where we've been entering all of our information and getting our calculations is if you have more than one CHW on staff who might be billing for Medicaid reimbursable services, you can get a little total picture estimate with all of them. So let's say you actually only have 3 on staff that might be providing these services. We can see that to employ all 3 for a whole year, the program would need $156,000, but total reimbursement from Medicaid for all 3 is $91,771, which leaves an annual program level difference of just over $65,000. So this is just nice for giving you that bigger level if you have multiple CHWs, what your program would see over the year in terms of cost versus reimbursement. So that's everything that's on this tab for using all 3 codes rather. And then, so I won't go through in detail in our individual patients only, our pink tabs 4 and 5, because they work exactly the same way. We have our green box for putting in the hourly rate plus the benefits cost. You can just see it's much simpler right here because we're only thinking about using 98960 Medicaid reimbursable services with individual clients. So again, we could say 3 or 4 hours a day might be reimbursable. How many hours do they work per day? 8 hours a day. And we have all of our information. And plus how many hours or how many weeks per year. So again, we'll put in our guess of 48 working weeks per year. And so just a few green boxes to fill in on this one, and you have your total difference, your total reimbursed amount. It also has the ability to put in how many CHWs are on staff to see what this looks like for our entire program. So again, annual cost for 3 CHWs, annual reimbursement for 3 CHWs doing those individual visits, which we estimated at 3 hours per day. And then the total program level difference. So if we go to our pie chart, our corresponding pie chart in pink on tab 5, we can see that 71% of the expenses would be covered by the Medicaid reimbursement. So, and then like I said, tab 6 explains the rates. So here's our start here tab to go back to. So this is where you'd start when your program's deciding which tabs to use. And we hope this is helpful to you.